So, now the odd thing about my injury here is all of these bones here, even the C2 and C3 and C4, they're all supposed to be the same height, right? Right. These two are pushed down, right? And there's some kind of fracture here, right? I don't know what you would call it, but from here, from here to here, compared to a normal X-ray, it's not uniformal. See how these are uniformal? So this happened in now here. All right, they're all aligned, right? See how neat they are fitting together too, right? So that could have happened at the wreck, right? I guess, but see this here, these two bones here, which are the C3 and the C4. So 1, 2, 3, 4, 5, 6. And I guess there's supposed to be 7 bones, right? Right. I guess here's the 7th, right? But these two are lower, and they're supposed to be even, right? Now, it also looks like there's a shadow, right? Right here, passing through the entire neck, right? I don't know what that means, right? But you don't see that on normal X-rays either. All right, here's another one.
If you're taking anatomy and physiology for the first time, I can guarantee it's not like any course that you've ever
So
taken.
this is
so
by
struggle with it. But what if I told you there's a secret study tool
noted
to help you ace
anatomist.
It's called Anatomy Bootcamp, and it was
Was
created for students like you taking anatomy for
posted on March 13th, 2020. Right.
Full of mnemonics and helpful memory aids.
But this too is
We're going
for
to cover the anatomy of a cervical
educational
X-ray, answer the what questions, what are the
purposes.
A's, B's, C's, and D's of a cervical X-ray, and what anatomy can you see on a lateral, anterior, and open mouth cervical X-ray? Hello everyone, my name is Dr. Morton, and I'm the noted anatomist. So a couple of things
Dr.
to know
Morton,
before we get started on cervical X-rays is that I'm not a radiologist, I'm an anatomist. So the perspective is going to be on understanding cervical anatomy using cervical
So
X-rays.
again, you see how they're all even though.
Demonstrate how radiologists interpret cervical X-rays. I'm kind of helping to give how when you look at
So see, these are even, right? These two are at least, right? How would you describe that? Let's see. Over a centimeter or two, right? Maybe 2 centimeters, right? Lower than they're supposed to be, right? Now, supposedly, now I don't know, right? I have amnesia, right? The only thing that could have happened is the windshield collapsed on my head, right? Now they're pretty thick though, right? by the 1980s, they were shatterproof at least, right? What that means is you have to break them a certain way. Even a sledgehammer can't just break one uniformly, right? In other words, if you hit it with a sledgehammer, it'll break the glass, but only where the sledgehammer hits, right? And I can show you other evidence later on dealing with a woman who was trapped in a car and she couldn't get out. Right.
X-rays to understand how you can see the anatomy. A couple of other things. When you're learning vertebrae, these are all the bony landmarks you should be familiar with. And so,
now, no one told me this. I'm walking around anyway, you know what I mean?
Tutorial on vertebral landmarks. A couple of other things. For covering cervical x-rays, the focus will be on lateral view, and I'll cover some on anterior and open mouth as well. Okay, for cervical
so we
spine,
got those x-rays as well.
Here's a textual outline of how I'm going to cover it, and click the link below to access a PDF of this outline.
So this is for educational purposes as well. If someone's lying to you, they're a doctor, they're not supposed to.
C's and D's.
Right. So
X-ray. Let's start with the first A.
So let's go back a little bit.
Tutorial on vertebral landmarks. A couple of other things. For covering cervical x-rays, the focus will be on lateral view, and I'll cover some on anterior and open mouth as well. Okay, for cervical spine and looking at lateral x-ray, here's a textual outline of how I'm going to cover it. And click the link below to access a PDF of this outline and the images we're going to be using. So there's a...
So first off, they're all uniformal, right? There's no holes in the skull, right? All right, so first off, these are way lower, the C3 and C4. You see a little avulsion here, like an injury or fracture right in here, right? Obviously. These are fine, and I don't know about the top, but obviously there's some injury here that was never noted to me, right? Now, another thing I noticed is there's a hole. See, this is the ear canal. There's a hole here, right? It looks a little odd, and it's just kind of weird, right? Don't know what it means per se, or why, but I got a hole right here, right? And the skull's supposed to be solid, right? No holes. Don't, again, know what it means, but not saying that. This is just simple comparison, my x-rays to a normal pair, right? And seeing if there's any difference that I wasn't told about. Yeah, that's it. So first off, we see their whole, this is just, of course, a drawing, right? But first thing we see is the two vertebrae here are lower by at least over 1.5 centimeters to 2 centimeters, right? How would that happen if the windshield collapsed on my head? Now, what can specifically, though, smash in two of the vertebra, like a nightstick or something like that, right? Or some kind of weapon, right? Maybe. Anyway. Right.
Cervical spine from a lateral view, and
but it's
X-ray.
Right. But it's not going to be, again, right? See, there's no hole, right? All right. Well, this one here is a little lower. But see the back here, right? Okay. That's lower, right? Mine's higher. So it's just simple comparison, right? But is this person injured or not, right? What is their injury? I mean, we don't know, right? So let's go on, find out what's going on.
So there are the A's, B's, C's, and D's of interpreting a lateral x-ray. Let's start with the first A, assessing 4 parallel lines: anterior and posterior vertebral line, spinal laminar line, and the posterior spinous line. And there the four lines are. Right. So the first one is the anterior vertebral line, and it is going to be there, right along the anterior margin of the vertebral bodies. Then the posterior vertebral line is going to be taking a look at those vertebral bodies, and it's located right along.
But do you see a hole
of the vertebral right. bodies? Now the spinal laminar
in the head, no,
the lamina shown there in pink.
Could that be a bullet? Right. At least a 22, maybe.
All the spinal laminar lines for the cervical vertebrae. It looks like that. The posterior margin, and it forms the posterior margin of the spinal or vertebral canal.
See?
And then last is a posterior spinous line. That if we look at those spines, and so what it does is it's the line that connects the tips of the spinous processes.
But
so there.
Why is his lower though, right? Right. Do you remember, right?
Let me say that again. There are the 4 parallel lines to assess. Now the line should follow a slightly secondary curve or a lordotic curvature that should be smooth and without step-offs. So if we take a look at that, smooth, not smooth. Smooth, not smooth, as you can see in that one with a spinal cord injury. And so what happens is if we look at this posterior vertebral line in the spine.
Right. So, this one here is even, right? These two are supposed, I mean, it dips down real low, right? And then goes back up, right? That's what I'm saying, right? And is this normal? So there's a hole here, right? And I don't know, you can kind of see that, right? What does that mean, right? Why do I have a hole in my head? In the side near the ear canal, right? See, that's the ear, by the way. And there's a hole right where the ear is, right? I'm just seeing abnormalities, that's all I mean, right? With my skull versus their skull. This is the C1, it's up higher, right? Right, than theirs, right? Then it dips, right? Then it dips, goes back up, right? And it's kind of awkward, right? Right? So, especially right in here, this is the C2, right? And C3, right? And no one said nothing about it because why? You're walking around, I'm walking around, right? 2 days later, right? Could that be why? I don't know. But still, theirs is still uniformal. See how theirs goes up and down uniformly? Mine goes, then, right. No, right. It's down. See, that ain't even a centimeter. Mine's almost down 2 centimeters. And see, this one here, right? Oops, not shooting your bird, right? But this one here is not even. Right. See. Right. Now, even if the windshield collapsed on my head, could it cause all that damage? I don't know.
Spinal laminar line, they form the vertebral canal right there, and
Mm-hmm.
that's where the spinal cord is located.
Right,
so
right.
There's the spinal cord. Okay, so let's now go to the next A, which is the atlanto-occipital alignment. Hey, puppy, that's my dog that just came in. Hey, Winnie. So
We don't know that.
let's first start with the atlas as we zoom in. So there is the atlas vertebra, or the C1 vertebra, again, getting its name because it holds the skull in its shoulder just like the god.
But you don't see any holes here, not even in the ear canal. My ear is more clear than their ear, but it still would be around here, right? Right? Right. But there's no holes, right? Right. And see, their C1 is lower, mine's way up there. Just comparison, like I said, maybe I'm different.
And then the C2 vertebra is right there. And
right.
The tooth-like projection is the dens, or the odontoid process, sticking up the top.
I don't know.
The clivus is there, and it should point downwards towards the den. And what? How did you find that in thin air? Well, I look for my happy faces. If I can't find a structure like if the clivus isn't quite like, oh, there it is, I look for things that make me smile. What makes me smile here? Well, the Sola-Turcica makes me smile. That wonderful structure there.
And see, what this is this is from the left side. Mine is from the right side, by the way. In other words, I'm like this, and they're like this, right?
Or it should point towards the dens. That was fun. Let's do it again, except with this illustration. That there is the Sola-Turcica housing pituitary gland. Deep to that, or inferior to that, is the sphenoid sinus, and along that posterior border, there's the clivus.
Now this could be a child's X-ray too. I don't know. Right.
Okay. So now the foramen magnum. The foramen magnum forms the anterior margin of the foramen can I say that again? The anterior margin of the foramen magnum lines up with the dens. So you see that thing. And then the posterior margin lines up with the C1.
All I know is if someone was to attack me, right, before the wreck, or before the fall, or after the fall, right,
so it doesn't look
I would tell them Jesus could heal me,
anterior margin of the dens,
and help me walk again, right, no matter how badly damaged I was.
To the next one, bones.
I know.
So we're going to identify the C1.
You could help me walk like the Wolverine,
right, of each vertebra, including the dens. And the vertebral body should line up with a gentle arch using the anterior and posterior marginal lines. So, there are our 7 cervical vertebrae. There are their numbers. And there's the anterior and posterior marginal lines that line up. So the bones.
Right. One of mine is obviously below. That. You only see 6. 1, 2, 3, 4, 5, 6. I guess this is supposed to be the 7th, right here. So, though, it's still relatively. So my atlas looks a little awkward too, right? And then there's a big old hole here, right? I don't know what that is, right? I don't know. Just little anomalies, if you will. I don't understand, right, on my x-rays, right? All I'm saying, I know. But, no. It does look, it's not round enough to be a bullet, but what, I mean, ice pick, right? I don't know. Right. Just saying, something looks like there's a hole below the ear, right? A knife, maybe, right? Okay, and see, my atlas here, right, is looks a little closer too, right, to the C2 there. All right. Now, yeah, by about a few millimeters, just not a lot, but and it looks more back, right? Don't know if that means anything, but or more up, right?
Next,
If
we're
you
going to
would,
look at the
right?
bony landmarks. So the bony landmarks are shown there. Let's cover them one by one. The vertebral body is first. There's the vertebral body of C1, and then there's C2 with that very prominent dens or odontoid process, and then C3, 4, 5, 6, and 7. There's our vertebral bodies. Next is the lamina. So before I cover the lamina, let's take a look why it looks kind of different than I expected to look at. So here is a superior view of the C3 cervical vertebra. But now let's take a look. There's the lamina outlined in green. So the head represents as if you're looking laterally at this vertebra. Now notice how your eyes come in. So there is the anterior line. So you can see the anterior part of the lamina, according to the cervical body. And then there is the posterior line closer to the spinous process. And so that is the anterior posterior dimension. But what happens as an x-ray is we do this. We flatten it out. But notice that we did not, that when you flatten it out, the anterior posterior direction doesn't change. And so when we look now, there's the C3 vertebra. And that green is showing the lamina with the anterior part and the posterior part and the very narrow. So it looks like the lamina is very small. It just runs more side to side.
And see, that's over a centimeter, almost two.
So
I know.
there are all the lamina
Of a difference, and
so the next is something
that
called
would
lateral
seem
mass. This is
more
one
that
that's used in
it was
radiology, not
hit.
so much in gross
I know.
anatomy. It's
To
the
go
bulky
down,
portion of the
right? I
cervical
mean, you know,
bone.
right, like with the
It's
stick,
lateral
right,
to the
or
vertebral
right.
foramen, but posterior to the vertebral body. So there's our C6 vertebra,
Or
and there's the vertebral
a
foramen,
nightstick
and
or a
there's the
bat,
body.
right?
So we go like this. Shing! That is the lateral mass. And the way that it looks is like that, okay, in this vertebra, in this lateral cervical x-ray. It's rhomboid shaped, and it projects downward and posteriorly. Okay. Next is the facet joint. And so here is a lateral illustration. And there is the inferior articular facet, and there's a superior articular facet, and together they make a facet joint.
Right. That's where they said I was injured
And
at
this
this
is
facet.
also known as
Right.
the zygapophyseal joint, and it's a synovial joint between articulating facets. So if you ever cracked you give someone a hug and you hear like a bunch of, like your knuckles are cracking, this is the joint that's cracking, okay? All right, there are those facet joints at an angle.
So it does
Next
look
is the
like there
pedicle,
was something
posterior
done
to
to the
vertebral body,
facet joints
and
as
it
well.
forms the superior and inferior margins of the
Which is what they noted in the
intervertebral
reg,
foramen.
right?
So there we have,
At the C2
there we
and
have in
C3,
yellow
right?
the
Which for this person is
you can see
right
it on the
here,
side like
right?
that. So the intervertebral
Right.
foramen is between superior and inferior pedicles. So there is an intervertebral foramen, and the number of the exiting nerve is the same number as the infra-adjacent.
Now this is just up on YouTube, I admit that, but no. Can you already, if you're a doctor, see a difference? Why aren't you telling me, doctor, about the differences? Right. I don't know. Ain't it your duty, even if you don't understand the injury, to tell me something's a little awkward here, right? This is the last one. I know. Right, 1, 2, 3, 4, 5, 6, and then 7, right? So the question is, does any of this look what abnormal? Like in Frankenstein, right? Especially, this is the C3 and C4 though. This is the C2. There's a lot facet here in here. Right. Now, here, okay, you again get uniformity, right? back. But it's supposed to go here, right? About here, right? Even if it was down a little, right? It ain't supposed to be that much, right? Unless something hit me on the back of the neck. See, I'm trying to determine if I was attacked at the wreck. And you hid it from them, from me. Right. Someone trying to take the law into their own hands when I was 16. Perhaps maybe the girl was 14, right? But it's not statutory rape until I'm 17 or 18, right? Why? I know, right? I'm still a minor. And the girl's within a certain age of me, right? And unless, right, the girl herself says I raped her, right, and calls it an actual rape, I'm still a minor myself, right? I can consent to sex myself at 16, right? Even with Roddy's old lady. Vivian. But I wouldn't, because Roddy's with her, right? I wouldn't even be with Donna. I know. So, but we're looking for abnormalities. One of them is, it also looks like the skull is closer to the atlas, right? Than it should be as well. It's a little closer, right? I know.
Adjacent vertebra. So there's the C4 and C5 vertebra. So the nerve that comes out is the C5.
And see, theirs is perfectly, the facets are fine, but my facets look jammed, right? Kind of down too, right? As if hit with a weapon. Not that it doesn't prove anything, but someone tried to kill me, I guess. Didn't succeed and didn't succeed. That's all, right? To prove, right? So these are more.
Now the spinous process, there's one, and there's all these other spinous processes. So, spinous processes are there. Okay. Now let's go to the cartilaginous space. So from bony landmarks to cartilaginous space. What do we mean by that? It's also known as the pre-dental space. It is the distance between the C1 body and the dens. And again, a odontoid process.
Now, don't mean the windshield also didn't collapse on my head if I was attacked and put in the car and wrecked in the car, right? They're trying to cover up a crime.
Zoom in.
You see,
there's the C1 vertebra.
It's called attempted murder, right?
C2 vertebra. And there's the dens. So we then come in like this.
Though normally most spinal cord injuries can result in a death, right?
C1 body and the dens.
Well, I guess they just knocked me out, put me in the car, and wrecked the car, and then I came to before the evidence got there.
From the space to the disc spaces. And so vertebral bodies are separated by.
Now, Roddy can't do nothing if he's involved with it or not. If I revive by the time the evidence is there.
They're not visible on X-rays because they're not dense enough. So if we then take a look at those vertebral bodies.
Though he's also a suspect, but I don't know, right?
And so
if we had it that bad, right?
C5 vertebra, that is an intervertebral disc, though you can't see it. You have to superimpose your knowledge of it, and we name the discs between the two vertebrae. So that would be the C4, C5 intervertebral disc. Let's go from disc spaces to soft tissue spaces in the prevertebral region. So it is the gray area between air and bone. So if we take a look at the spectrum where dark or black is air because it's not dense at all, and then we look at bright white and
Now,
bone,
like I said, the problem is the hole in
and
the
everything in
head.
between are all these different shades of gray with soft tissue.
Someone tried to murder
There's a
me,
joke in
by
there
the
somewhere.
way.
So that soft tissue
That could be a small
gray
knife
because it's not
puncture or
less
rape.
dense as bone, but it's not as dense as bone.
Don't know.
I say that again. It's
So this
soft
is
tissue, it's
2017,
gray because
right?
it's not air, which would be black, or it's not as dense as bone, which would be white. So let's zoom down here and take a look at what we can see. There's air, because it's close to being dark. That's in the trachea and larynx. That's bone, because it's more bright white. There's your vertebrae, so we go like this. Shing, there's the soft tissue in between, okay? And that area that I've outlined dotted, that is this soft tissue space, or the prevertebral soft tissue in between.
And see, if I am being murdered, though, could it be repeatedly?
So maxillary teeth, nasal
If
cavity,
Jesus has
frontal,
resurrected
they're
me
some of the
too,
happy
like
faces I look for.
he was
Then I look for
resurrected.
the hyoid. That's another happy
Uh-oh.
face. So then I look at the nasal cavity, so that would be the nasal pharynx.
See, if I go to Jerusalem and I think I'm one of the two witnesses, they might come at me with AK-47s or weapons of mass destruction, and I have to survive all
Some of the
that.
landmarks in this,
Just me and maybe
prevertebral or
4
soft
other
tissue
people are
space.
going to be on the Temple Mount
It's
anyway,
gray
right?
between air and bone. So
Once this
when we're
rebuilt.
looking at this gray area, above C4 we call the retropharyngeal space.
Don't rebuild it, though.
And
But
below C4 is the retrotracheal
if you got
space.
to, you
Hey,
got
kitty,
to,
I'm
right?
gonna sit on my lap. I'm doing this from home because of the COVID-19 thing going on. The University of Utah is closed, so all my pets keep coming out. I'm like, well,
But-
Dr. Doolittle, except hopefully this is more exciting than the movie. Okay, anyways. So, I
Their
digress. So,
X-ray's a little bit clearer
there's
than
our
mine, though, with
C1.
the
So
C7
there's the
for
base
some
of the
reason.
skull.
That's all
And then
I'm
there's the
saying.
C1,
Right.
C2, C3, and C4 vertebra. I find my C4 vertebra, and above it, in this gray soft tissue space, there's the retropharyngeal space above C4, and there's the retrotracheal space below C4. Notice
If something's for educational purposes or just to note differences, comparison-wise, right? I never say I'm a doctor, but I am at least a high school educated with at least almost 2 years of pharmacy tech school, right? With the Ultimate Academy, all right. Right. So, like I said, Right. If there is anything wrong, right? It seems to be mainly right in here, right? The C3 to C4, right? So this is the C2. It's pushed, right? These 3 vertebrae, 1, 2, 3, look different. These 2 are pushed down lower than the normal line would be, right? And then from here to here, see what I mean? Right? The line should be somewhere in here, right? And these 2 are way lower. So, cause you have to go from here straight down and then back up, right? And this one here seems higher for some reason, right? So this goes up to here, right? Now, that could be the windshield collapsing on the head, though, couldn't it? I don't know, right? But this is the problem, right? It's in my opinion, right? Not as a doctor, but as a patient trying to figure out, well, what the hell happened? Yeah. Why is it so awkward? Why are there holes in my skull? Though it healed, I mean, there's no real injury, right? I guess this would be somewhere in here. All right. I don't know. Right. But it looks crushed, right? I mean, yeah, I could understand if the windshield collapsed on the head, that could do that, right? Maybe. Or if I'm hit in the back of the neck, right, with a weapon, maybe. I don't know. Why is there a hole near the ear, right? And it's not the ear canal, right? What is that? I don't know. That's not normal, right? And it's pretty obvious it's a hole. Well, see, the problem with someone being resurrected is they don't even know what happened. Right. If you understand what I mean. I don't know. Had to be resurrected. Right? I have amnesia of what happened. Not full amnesia either, right? I remember to a certain point, right? And then taking little Roddy to Guyton, right? And him going into the store and me waiting in the car, right? Him getting what he wanted and then going down Old 17 to drop him off at Vivian's, right? But then when I get to the road, that's where I black out, right? Same is true with the fall. I wake up in the ER, right? And again, this can't prove attempted murder, but it's a damn good other possibility. I don't know. Well, one was before and one was after, too, right? 8 years apart. And I'm still functioning on both injuries, right? Not the same, of course, right? Who would expect that? But I can still, kick it a course line if I had to. If you know what I mean, right? I don't know. See, all I gotta do is stretch out a little, and then I'm like, I could do some of the things I could do before I fell, but not the amount of time, right? That's the only difference. See, I could walk from dusk to dawn, right? Work a job, right? Before I joined the Navy, I did a lot of stuff. I know. I worked Rogerwood again. I worked part-time job. I was doing my karate still that Cliff taught me. I was reading books by Stephen Gay Hayes and doing some of the things they demonstrated in the book. And I had some of the Ishida Kim books, right, too, right? So I was doing some of that stuff. Which was demonstrated on how to do it, right? Not everything, right? Some of it required flipping over or something, right? If someone had you in a certain armbar, and things like that. Yeah. But already we're seeing slight differences between the C1 to C4. Between this man's x-rays and mine, right? Though his is the lateral view from the left side and mine's from the right. That's the only difference here, right? All right there too, right?
So
not being a doctor, but just a patient who don't know what the hell's going on here, right?
Now, the general rule for soft tissue spacing is this. It's 6 millimeters at C2 and 2 centimeters at C6.
Still someone trying to attempt to murder him.
Centimeters. So there's C4, and there's our soft tissue area, and there's C2, and there's C6. So let's do this. Zoom in. There's C2, so it's 6 millimeters at C2. Now let's go down to C6, and there it is 2 centimeters at C6. Okay? So the general rule for soft tissue spacing is that there's normal and there's abnormal. Okay? So there's abnormal. C2, C4, and C6 in both of these.
Yeah.
C2, look at this.
Mine's abnormal spacing. I know it is, right.
So you see. The dark area, which is air.
Right. That especially their C1 and C2 is abnormal like mine, I know.
6 millimeters.
I can see a difference, right?
Wow.
And see, theirs is up more.
6 millimeters.
Mine is down more.
Recognize that in this area, it should be very narrow, but in the abnormal one, it is wider because something, could be blood or pus, is expanding that area. Normal, look at the yellow line, abnormal, normal, abnormal, normal, abnormal.
So we already can see
Now
at the C1 and C2 it's abnormal as well. The C2
spine. And
to the C3 and 4 are abnormal, right?
Showing in a line, we need to look at an alignment. The
now,
lateral edges of the C spine must be aligned.
This view looks fine, right?
And the
which is odd too, ain't it? Right?
Must be in a straight line.
Why is the back view getting damaged more, right? Of course, if I'm hitting the back of the head, that can explain that, right?
And now let's look at a cervical spine and an anterior view with an open mouth.
Mm-hmm.
So the open mouth, we're looking for the dens or odontoid process, and we're looking for the distance between the dens, C2, and the lateral masses of C1. They should be equal.
So someone could have hit me in the back of the head.
There's the dens.
To kill me, right?
Lateral masses on both
right.
sides. So there is the dens, and there are those lateral masses, and we're looking for the distance that should be equal between them. So that, my friends, is showing the anatomy of a cervical X-ray in a nutshell.
Okay, all right. Don't worry, be happy. Don't worry, be happy now. Okay. Whoops. Cuckoo for cuckoo. Alright, what's he doing? I'm trying to stop it. Right. There we go. Ah, there it is. All right. That's the same view, right? Mm-hmm. Right. And so you still see, right? The C1 of mine is what? Even, right? And again, right, like I said, it's usually uniform, right? Mine's down almost over 1.5 centimeters, right? Mm-hmm. So this is just the patient. I'm trying to figure out what he'll open. Right. Not as a doctor, but as a concerned patient, right? So like I said, right. No one said nothing, huh? Right. Oh, the C1 is the one looking impressed there, but he's walking, that's okay. I know. I don't mind now, I'm not complaining, but divine intervention comes to mind, though. Exactly. Right. So this is where they thought they C2 and C3 were meant to, right? At the lock facets. So, is that locked or crushed? What's the difference, right? I don't know. But it still takes 6 weeks to usually heal from just a simple lock facet now. And see, the thing is, I don't know, right? Right. Mm-hmm. All right. Right. And I don't want to get anybody in trouble, like I said, anyway. But. Mm-hmm. So, mm-hmm. So here we have another one, right? And again, it's the C1's right here, and it's still lower, right? And see, the uniformity, right? As I'm pointing out, right? So see 1, 2, 3, 4, 5, 6, 7's there like mine, right? So do you automatically, or can you tell any differences? And I'm an untrained physician or person, right? Or you want to call me, right? As far as reading x-rays is concerned and stuff like that, right? So, right. No one sees a difference, though, right? Could there be two other possibilities, right? Could someone have tried to hit me over the head, right? Put me in the car and then the windshield collapsed on my head? Could that explain both injuries, right? Both legs, right? Right. And there's a hole here, right? There's a hole in my head that can only be filled by a bone, wholehearted, but the bone's missing. Where's the bone in my head? Seriously. You know that song? Right. So that is me, right? From me, and and like I said, nobody's saying nothing, right? So what am I supposed to do about it, right? I see oddities there, but I'm not the doctor. You are, you are. So I'm supposed to diagnose myself, right? But if someone hit me in the back of the neck, say I was trying to run away or something, and they caught up with me and hit me in the back of the neck or something, right? I could explain that, right? Or again, right? And then put me in the car to wreck it while I was unconscious, right? And they're trying to kill me, it seems, right? Is that not right? Way down, right? So you gotta imagine this too, right? From here, do you see what I mean? Right. If I'm hitting the back of the head, though, could that explain that? Then putting the car in the windshield collapses on my head, right? Right. I don't know. Right. And that would push the C1 and C2 down. I mean, the C1 on top of the C2, right? I don't know. Maybe. But that's two injuries I was never told about, or right. And see, like I said, is uniformal. Right. Now this is up a little higher, but right. But see, there's C1, 2, 3, 4, 5. See, there's no, I call it my Zorro mark. Whatever you want to call it. But you can see the fracture. See, this is pushed. Right. See the Z? Right. They don't have the Z. I got a Z. The Zorro mark. Right. All this looks smashed, right? Attempt to murder. Well, I say attempt because only with Jesus could you survive a spinal cord injury of that magnitude, right? So, You definitely don't see the Z, right? I don't know. So that's 2. I also want them to stop trying to kill me if they're trying to kill me, because I don't know if they're still not trying to kill me. As you just saying, saving me like from here on. So I keep telling me he can heal me like the Wolverine, right? Right? Smart man. But like I said, you don't see a difference. And I'm not a trained doctor, so you're supposed to see the differences, right? Not me, the patient, right? Right, right. Right. So all this looks crushed, right? Like it was hit, right? And pushed into the bone, right? And there's a nightstick that might could do that. There's, right? It's got to be something that would fit there too, right? You know, it can't be just, right? See, I got a sticker there. That might fit, right? And actually fit the neck itself too, right? Right. Okay. Exactly, right. And I'm trying to explain both injuries while the C2 and C1 are closer than they should be, right? You can tell that too, right? So theirs looks at least 2 millimeters, and mine looks barely a millimeter, 2 to 3, right? And theirs is way lower, right? I don't know. And see, I don't know if I was attacked or not, but if I was, I don't know. They might have a Jones for me by now. They're trying to hide. They tried to kill me, and I'm seeing the evidence, and you won't. You won't. Right. That ain't even a millimeter, right, from one another, right? I know. And it looks like it was collapsed again. See, even all this, right? It's way closer than it should be. Even the skull looks compressed upon the C1, right? I know the problem is people can't normally walk on that. And leave the hospital 2 days later if it was the wreck or the fall, by the way, right? Either one, you can't just walk away like nothing happened, right? Or wake up the same night and be moving your upper body and lower body, and then, right? Am I wrong, right? I'm not trying to diagnose it, but I'm asking, like, you know, a patient, right, who sees this and what would be the results, right? Normally, if your C1 is collapsed on your skull, right? down, right? Could have been someone hit me over the head and front of the head and back of the head. I don't know, right? And that's possible too, right? And then the hole could be either kind of like a ice pick. Just to say. Have a nice day.